Question 1. A client 12 hours post-thyroidectomy suddenly becomes restless and reports tingling around the mouth. Which action should the nurse take first? A. Notify the provider. B. Assess for Chvostek's sign. C. Prepare IV calcium gluconate. D. Apply oxygen at 2 L per minute. The answer is C. Prepare IV calcium gluconate. Rationale. Perioral tingling and restlessness after thyroidectomy suggest acute hypocalcemia from accidental parathyroid removal. Airway compromise from laryngospasm is imminent. Treat first with IV calcium. Assessment delays treatment. Question 2. A client with heart failure has BP 88/54, heart rate 118, crackles, and urine output 15 ml per hour. Which medication should the nurse question? A. Furosemide. B. Lisinopril. C. Dopamine infusion. D. Dobutamine infusion. The answer is B. Lisinopril. Rationale. Client is hypotensive and in low output failure. ACE inhibitors lower BP further. Inotropes, dopamine or dobutamine, support perfusion. Diuretics may still be indicated for congestion, but ACE inhibitor is unsafe right now. Question 3. A nurse is caring for 4 clients. Which client should be seen first? A. COPD client with O2 sat 90% on 2 liters. B. DKA client with glucose 280 milligrams per deciliter. C. Post-op hip replacement with confusion and RR8. D. Stroke client with BP 188/94. Answer. C. Post-op hip replacement with confusion and RR8. Rationale. RR8 indicates respiratory depression, immediate airway threat. Oxygenation and ventilation always priority over chronic hypoxia, hyperglycemia, or permissive hypertension in stroke. Question 4. A client with SIADH has sodium 118 milliequivalents per liter. Which assessment finding is most concerning? A. Muscle cramps. B. Headache. C. Seizure activity. D. Weight gain of 1 kilogram. Answer. C. Seizure activity. Rationale. Severe hyponatremia causes cerebral edema leading to seizures. This is a life-threatening complication requiring hypertonic saline. Question 5. A client with suspected pulmonary embolism has sudden dyspnea and anxiety. ABG results pH 7.49, PaCO2 30, HCO3 24. What does this indicate? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Compensated acidosis. Answer. B. Respiratory alkalosis. Rationale. Elevated pH with low CO2 indicates acute respiratory alkalosis from hyperventilation, common in early pulmonary embolism. Question 6. A client receiving heparin infusion has APTT 110 seconds. What is the nurse's priority action? A. Continue infusion. B. Increase infusion rate. C. Stop infusion. D. Administer vitamin K. The answer is C. Stop infusion. The rationale is therapeutic APTT is 1.5 to 2.5 times control, about 60 to 80 seconds. 110 seconds is supratherapeutic, high bleeding risk. Stop infusion. Vitamin K reverses warfarin, not heparin. Question 7. A burn client 8 hours post-injury has urine output of 20 milliliters per hour. What is the priority? A. Decrease IV fluids. B. Increase IV fluids. C. Administer furosemide. D. Check potassium level. The answer is B. Increase IV fluids. The rationale is in first 24 hours of burn, fluid resuscitation is critical. Low urine output, less than 30 milliliters per hour, indicates inadequate perfusion. Increase fluids per protocol. Question 8. A client with Addison's disease develops vomiting, hypotension, and confusion. Which medication should the nurse prepare? A. Insulin. B. Levothyroxine. C. Hydrocortisone IV. D. Potassium chloride. The answer is C. Hydrocortisone IV. The rationale is Addisonian crisis equals cortisol deficiency causing shock. Immediate IV corticosteroids are life-saving. Question 9. Which finding in a client with increased ICP requires immediate intervention? A. BP 168/70. B. Pupils equal and reactive. C. Decorticate posturing. D. Headache rated 6 out of 10. The answer is C. Decorticate posturing. The rationale is abnormal motor posturing indicates worsening brain injury and herniation risk. This is late and critical. Question 10. A client with DKA has potassium 5.8 milliequivalents per liter before insulin therapy. What is the priority? A. Administer potassium. B. Start insulin infusion. C. Restrict fluids. D. Give sodium bicarbonate. The answer is B. Start insulin infusion. The rationale is hyperkalemia in DKA is due to acidosis shift. Insulin drives potassium into cells. Do not give potassium until level drops. Question 11. A client with cirrhosis suddenly becomes confused and lethargic. Ammonia level is elevated. Which prescription should the nurse implement first? A. Restrict protein intake. B. Administer lactulose. C. Prepare for paracentesis. D. Start IV albumin. Answer. B. Administer lactulose. Rationale. Hepatic encephalopathy from ammonia accumulation is treated immediately with lactulose to trap ammonia in the gut. Protein restriction is not first line in acute deterioration. Question 12. A client with chest pain has ST elevation in leads 2, 3, and AVF. Which complication is most likely? A. Pulmonary edema. B. Cardiogenic shock. C. Right ventricular infarction. D. Ventricular septal rupture. Answer. C. Right ventricular infarction. Rationale. Inferior wall MI, I3, and AVF often involve the right ventricle. Watch for hypotension and preload dependence. Question 13. A client receiving TPN suddenly develops dyspnea and chest pain after central line insertion. What is the priority? A. Check blood glucose. B. Obtain chest X-ray. C. Place client in high Fowler's. D. Stop infusion and assess breath sounds. Answer. D. Stop infusion and assess breath sounds. Rationale. Suspect pneumothorax. Stop infusion immediately and assess. Airway breathing priority before diagnostics. Question 14. A client with pancreatitis has calcium 7.2 milligrams per deciliter. Which finding requires immediate action? A. Positive Trousseau sign. B. Epigastric pain. C. Elevated lipase. D. Glucose 180 milligrams per deciliter. Answer. A. Positive Trousseau sign. Rationale. Hypocalcemia can cause tetany and laryngospasm. This is an airway emergency. Question 15. A nurse notes peaked T waves on telemetry. Which lab value confirms suspicion? A. Potassium 6.8 milliequivalents per liter. B. Magnesium 1.2 milligrams per deciliter. C. Sodium 150 milliequivalents per liter. D. Calcium 11 milligrams per deciliter. Answer. A. Potassium 6.8 milliequivalents per liter. Rationale. Peaked T waves are classic hyperkalemia ECG changes. 6.8 is life-threatening. Question 16. A client with sepsis has lactate 6 millimoles per liter and MAP 60 millimeters mercury after fluids. What is the next intervention? A. Start vasopressor. B. Administer diuretic. C. Restrict fluids. D. Give beta blocker. Answer. A. Start vasopressor. Rationale. Persistent hypotension after fluids equals septic shock. Vasopressors required to maintain MAP greater than or equal to 65. Question 17. A postpartum client saturates one perineal pad in 10 minutes. What is the priority? A. Fundal massage. B. Check blood pressure. C. Notify provider. D. Prepare oxytocin infusion. Answer. A. Fundal massage. Rationale. First action for postpartum hemorrhage is massage the fundus to stimulate uterine contraction. Question 18. A client with myasthenia gravis develops respiratory distress after receiving pyridostigmine. What is suspected? A. Myasthenic crisis. B. Cholinergic crisis. C. Stroke. D. Anxiety attack. Answer. B. Cholinergic crisis. Rationale. Excess anticholinesterase causes respiratory weakness and secretions. Differentiate from myasthenic crisis. Timing after medication suggests cholinergic. Question 19. A client with acute glomerulonephritis has BP 190/110 and headache. Which action is priority? A. Restrict protein. B. Administer antihypertensive. C. Measure urine output. D. Encourage fluids. Answer. B. Administer antihypertensive. Rationale. Severe hypertension risks stroke. Control BP immediately. Question 20. A client on warfarin has INR 6.5 with no bleeding. What should the nurse anticipate? A. Increase dose. B. Administer protamine. C. Hold warfarin. D. Give heparin. Answer. C. Hold warfarin. Rationale. INR 6.5 is supratherapeutic. No bleeding equals hold dose. Protamine reverses heparin, not warfarin.
Question 21. A client receiving magnesium sulfate has RR 10 per minute. What is the antidote? A. Naloxone. B. Calcium gluconate. C. Potassium chloride. D. Sodium bicarbonate. Answer. B. Calcium gluconate. Rationale. Magnesium toxicity causes respiratory depression. Calcium gluconate reverses effects. Question 22. A client with bacterial meningitis suddenly becomes bradycardic and hypotensive. What is occurring? A. Septic shock. B. Cushing's triad. C. Hypovolemia. D. Anaphylaxis. Answer. B. Cushing's triad. Rationale. Bradycardia plus hypertension indicates increased ICP and impending herniation. Question 23. A client with COPD on 2 liters O2 has ABG pH 7.32, PaCO2 55, HCO3 29. Interpretation. A. Respiratory acidosis with compensation. B. Metabolic acidosis. C. Respiratory alkalosis. D. Fully compensated alkalosis. Answer. A. Respiratory acidosis with compensation. Rationale. Low pH plus high CO2 equals respiratory acidosis. Elevated HCO3 shows metabolic compensation.
Question 24. A client with chest trauma has tracheal deviation and absent breath sounds. What is priority? A. Chest X-ray. B. Needle decompression. C. Oxygen 2 liters. D. IV fluids. Answer: B. Needle decompression. Rationale: tension pneumothorax is immediately life-threatening. Decompress before imaging. Question 25. A client with DVT develops sudden chest pain and hypotension. Which medication is priority? A. Aspirin. B. Heparin. C. Alteplase. D. Metoprolol. Answer: C. Alteplase. Rationale: massive PE with hypotension requires thrombolytics. Question 26. A client with hyperkalemia receives insulin and dextrose. What is the purpose? A. Remove potassium from the body. B. Prevent hypoglycemia. C. Shift potassium into cells. D. Increase renal excretion. Answer: C. Shift potassium into cells. Rationale: insulin drives potassium intracellularly. Dextrose prevents hypoglycemia.
Question 27. A client 24 hours post-op suddenly becomes confused and pulls at lines. What is priority? A. Apply restraints. B. Check oxygen saturation. C. Call family. D. Administer sedative. The answer is B. Check oxygen saturation. Rationale: acute confusion often due to hypoxia. Always assess oxygenation first. Question 28. A client with eclampsia has seizure activity. What is first action? A. Insert oral airway. B. Turn client to side. C. Restrain limbs. D. Check reflexes. The answer is B. Turn client to side. Rationale: protect airway and prevent aspiration during seizure. Question 29. A client receiving blood transfusion develops fever and chills. What is first action? A. Slow infusion. B. Stop transfusion. C. Administer acetaminophen. D. Notify provider. The answer is B. Stop transfusion. Rationale: stop immediately to prevent worsening reaction, then notify provider. Question 30. A client with HHS has glucose 920 milligrams per deciliter and confusion. Which finding differentiates HHS from DKA? A. Severe hyperglycemia. B. Ketone production. C. Dehydration. D. Polyuria. The answer is B. Ketone production. Rationale: HHS has minimal no ketones. DKA has significant ketosis. Question 31. A client with compartment syndrome reports increasing pain unrelieved by opioids. Priority: A. Elevate limb. B. Apply heat. C. Notify provider. D. Massage extremity. The answer is C. Notify provider. Rationale: unrelieved pain is classic early sign. Requires emergent fasciotomy. Question 32. A client with MI develops new systolic murmur and hypotension. Suspected complication: A. Pericarditis. B. Papillary muscle rupture. C. Cardiac tamponade. D. Atriofibrillation. The answer is B. Papillary muscle rupture. Rationale: new murmur plus shock post-MI indicates acute mitral regurgitation from papillary muscle rupture. Question 33. A client with asthma has silent chest on auscultation, meaning A. Improvement. B. Severe airway obstruction. C. Anxiety. D. Hyperventilation. Answer: B. Severe airway obstruction. Rationale: silent chest means minimal airflow, impending respiratory failure. Question 34. A client with renal failure has calcium 6.5 milligrams per deciliter and phosphorus 6.0 milligrams per deciliter. Cause: A. Vitamin D excess.
B. Parathyroid suppression. C. Phosphate retention. D. Hyperthyroidism. Answer: C. Phosphate retention. Rationale: kidney failure causes phosphate retention, binds calcium, hypocalcemia. Question 35. A client on digoxin has nausea and yellow vision. Action: A. Administer next dose. B. Check digoxin level. C. Give potassium. D. Hold beta blocker. Answer: B. Check digoxin level. Rationale: classic digoxin toxicity signs. Verify level before giving. Question 36. A client with a spinal cord injury above T6 develops pounding headache and BP 210/110. Priority: A. Lay flat. B. Check bladder. C. Give analgesic. D. Increase IV fluids. Answer: B. Check bladder. Rationale: autonomic dysreflexia commonly triggered by bladder distension. Remove stimulus. Question 37. A client with metabolic acidosis is compensating. What respiratory pattern is expected? A. Bradypnea. B. Kussmaul respirations. C. Shallow breathing. D. Apnea. Answer: B. Kussmaul respirations. Rationale: deep rapid breathing to blow off CO2 in metabolic acidosis. Question 38. A client post-thoracentesis becomes dyspneic. Priority: A. Check breath sounds. B. Obtain X-ray. C. Notify provider. D. Elevate head. Answer: A. Check breath sounds. Rationale: assess first for pneumothorax before other actions.
Question 39. A client with septic shock has CVP 2 mmHg. Interpretation: A. Fluid overload. B. Adequate preload. C. Hypovolemia. D. Cardiac tamponade. Answer: C. Hypovolemia. Rationale: low CVP indicates inadequate preload, needs fluids. Question 40. A client on morphine has RR6 per minute. Action: A. Stimulate client. B. Administer naloxone. C. Give oxygen. D. Check BP. Answer: B. Administer naloxone. Rationale: severe opioid-induced respiratory depression requires reversal. Question 41. A client with PE is restless and anxious. Why? A. Hypoglycemia. B. Hypoxia. C. Fever. D. Acidosis. Answer: B. Hypoxia. Rationale: early sign of hypoxia is anxiety or restlessness. Question 42. A client with diabetic neuropathy has foot ulcer with black eschar, meaning: A. Infection. B. Healing. C. Necrosis. D. Granulation. Answer: C. Necrosis. Rationale: black eschar indicates tissue death. Question 43. A client with hyponatremia receives hypertonic saline. Risk: A. Pulmonary embolism. B. Central pontine myelinolysis. C. Hyperkalemia. D. Metabolic acidosis. Answer: B. Central pontine myelinolysis. Rationale: rapid sodium correction causes osmotic demyelination. Question 44. A client with ARDS has PaO2 55 on 100% O2. Next intervention: A. Decrease oxygen. B. Intubate with PEEP.
C. Give diuretic. D. Start antibiotics. Answer: B. Intubate with PEEP. Rationale: severe refractory hypoxemia requires mechanical ventilation with PEEP. Question 45. A client with pancreatitis develops sudden dyspnea. Suspected complication: A. Atelectasis. B. ARDS. C. Pleural effusion. D. Pneumonia. Answer: B. ARDS. Rationale: pancreatitis can trigger systemic inflammation leading to ARDS.
Question 46. A client with acute stroke has BP 200/100. What is priority? A. Rapidly lower BP. B. Maintain perfusion. C. Give nitroglycerin. D. Restrict fluids. Answer: B. Maintain perfusion. Rationale: in acute ischemic stroke, permissive hypertension maintains cerebral perfusion unless extremely elevated. Question 47. A client with liver failure has INR 4.8 and bleeding gums. What medication is anticipated? A. Heparin. B. Vitamin K. C. Aspirin. D. Alteplase. Answer: B. Vitamin K. Rationale: liver failure reduces clotting factors. Vitamin K may help correct coagulopathy. Question 48. A client with hyperthyroidism develops fever 104 degrees Fahrenheit and tachycardia. Diagnosis: A. Sepsis. B. Thyroid storm. C. Heat stroke. D. Panic attack. Answer: B. Thyroid storm. Rationale: severe hyperthermia and tachycardia in hyperthyroid patient equals thyroid storm. Question 49. A client with bowel obstruction suddenly has relief of pain and rigid abdomen. Meaning: A. Improvement. B. Perforation. C. Constipation. D. Gas movement. Answer: B. Perforation. Rationale: sudden relief followed by rigidity suggests rupture and peritonitis. Question 50. A client with heart failure has BNP 1,800 picograms per milliliter. Interpretation: A. Normal finding. B. Renal failure. C. Severe heart failure. D. Myocardial infarction. Answer: C. Severe heart failure. Rationale: BNP is elevated with ventricular stretch. 1800 indicates significant decompensation.
If you were able to survive these 50 tricky questions, then you're not studying at a beginner level anymore. You're thinking like a real NCLEX test taker. Remember, the NCLEX is not about memorizing facts. It's about recognizing priorities, spotting traps, and choosing the safest answer under pressure. The difference between passing and failing is often one small clinical detail. If this video challenged you, good. That means you're growing. Make sure you subscribe to MCQs Master 101. Turn on notifications and keep training your clinical judgment every single day. Consistency beats panic on exam day. Drop your score in the comments. Let me know which question trapped you the most. And until the next set, stay sharp, think priority, protect the airway, and I'll see you in the next NCLEX review.